Hello, everyone. A reminder that we're going to be recording the whole session today, and we're going to get started. Welcome to this webinar presented by our Perinatal Services BC team members. I'm Marianne Morgan, the Primary Care Medical Lead, and we are keen to tour you around the brand new Perinatal and Newborn Health Hub. I acknowledge with gratitude that we are all gathered on various traditional and ancestral and unceded territories across British Columbia, with First Nations who have nurtured and cared for the lands and waters around us for all time. I give thanks as an occupier, and currently I'm on 6 First Nations territories, colonially known as Kelowna, for the opportunity to live, work, and support care here. I'll give you a moment just to reflect on where you're calling in from today and how things are. I know most of our province is covered in snow again today. So before we get started, we'd like to do a quick poll to see the range of providers joining us and where you are joining from. That should pop up in front of you in just a moment here. So there's 2 questions to answer. What do you do for a living? And where are you signing in from? Give a few more seconds. And anybody just signing in, thanks. We're just doing a quick poll. And then we're getting going. It doesn't look like the numbers are moving much anymore. Okay. So lots of our nursing colleagues joining in and a few more of everybody else. And I can't see our health authority answers, but we'll share it with you after. I think we probably have a great selection from across the province. So you'll have to click the stop sharing button to get rid of that poll in front of you. And we'd like to start by thanking and acknowledging the thousands of perinatal healthcare providers in BC that have informed and contributed to our hub. Before we embarked on this project, PSBC surveyed providers across BC. Up-to-date and accessible information was the big request. We work closely with the Office of Virtual Health, which is now known as Provincial Digital Solutions. Our goal is to provide an easy access educational and information site with a BC focus. Our big and exciting challenge has been the creation of many clinical care topics to guide your practice. And here's our agenda listed here for the hour. We're going to review the transition between the old and the new sites, have a live demonstration, and then answer questions. It's been more than a 2-year journey for us, and we continue to add clinical topics written and reviewed by you and your colleagues. The hub is for anyone in BC who provides care to pregnant women and their newborns. No login is required for access to this site, but creating an account gives you more options. And I'm going to turn this over to our knowledge translation expert, Melanie Gandon, who will now show you around.
Thank you, Marianne. So prior to jumping into our live demo of the website, I wanted to take a few minutes to discuss how the 2 websites, both the PSBC website and our hub site will function. So with the launch of the hub, all of our PSBC healthcare provider content and resources has moved over to the hub. The PSBC site will continue to host all of your patient and family-facing resources, and these resources will also be linked from the hub whenever applicable, for a seamless navigation across both your platforms. The hub is, however, the most up-to-date of the 2 websites, and it is where all the healthcare provider content will be posted. So back in the spring, we did a formal cleanup at PSBC of the PSBC website backend. We found over 1,100 website items existed, and from there, subject matter teams at PSBC filtered through and prioritized what would stay and what would go. So approximately 440 items were marked to remain on the PSBC site. So these are your patient, family-facing resources, as well as data and surveillance reports and indicators. About 360 items were marked to be removed, and they've since been archived and removed from the website. We did use 2015 as our cutoff date, so unless the document is still clinically relevant, it was removed. And then approximately 250 items migrated over to the hub, in addition to our newly created content and suite of new resources. So there has and will continue to be an overlap period where the items that have migrated over to the hub can still be found on the PSBC website. These will gradually be removed from the PSBC site beginning this month, and there will be redirect links from the PSBC website to guide users to where the applicable documents are hosted on the hub. As a final step to the PSBC website cleanup, we looked at reorganizing, as we know that the site will be a lot more bare with all the archived and migrated content. So we're going to continue to optimize the organization of our patient and family-facing resources so that they're easy to access. These resources can be found under the Health Info section, which is located on the main banner, and you can see in the first image on the left. Okay, so now that I've given you a little bit of a background on that, we're going to jump right into our hub demo. I'll be walking you through the different sections of the website, and I will demo to you how you can use the hub in your practice. If any questions come up throughout our presentation today, feel free to pop them in the Q&A box, and we'll have time to answer questions at the end. This is an early iteration of the hub, so we will continue to gather feedback from users like you to optimize our website and the user experience. We continue to work on improving the site, including the speed at which items and pages are loading. For today's demo, I'll be using a computer monitor, and depending on which type of device you're using, things may look a little bit different. So we will continue to optimize that mobile experience for users who are accessing this from a mobile device. All right, so the first step in our demo today is we are going to look at our newly created clinical care topics. So we've created over 100 unique evidence-informed clinical care topics that capture all phases of the pregnancy continuum, from preconception all the way through to postpartum and newborn care. Currently, we have 67 uploaded topics, and we continue to add more as they're finalized. Now, there's a variety of ways that you can access and reach the clinical care topics on the website. No matter where you are on the site, you can easily navigate to find the clinical information that you're looking for in just a few short clicks. So, for example, if I start on the homepage here, I might use the Continuum of Care filter, and I can click through the relevant phase of the pregnancy journey that interests me. Now, if you find the main navigation bar intuitive, you can click directly to the clinical care topic landing page by hovering your mouse over clinical guidance, and then by clicking on clinical care topics. That a second to load. I wonder if people are following along live, the site may be lagging from a little bit of extra activity. All right, well, while that's loading, I will show you the filter features, which we can see on the page here. So from here, typically, there we go. It's a little bit delayed. We've got the list of topics. So you can see that a lot of topics are listed here. And you may want to start by filtering it down a little bit. So on the left-hand side of the page, you can further narrow down your search for topics. Here, again, you'll find the phases of pregnancy. Alternatively, you can sort through topics according to their categories, and this will refine the list. On the top right-hand side of the page, you can also sort how the list of topics appears. So this can be sorted according to your preferences. It'll automatically preset to display clinical care topics in alphabetical order. But if you'd like to change this, just select whatever your preference is. Now, a common way that we know people tend to search the site is by using the main search bar at the top of the page. Here, you can type in your search term and then click on the magnifying glass or hit enter to search. Give it a sec. I think it's running a bit slower. I'm assuming it's from extra people maybe following along live because we did do a demo just a few minutes ago and the site was a little bit faster. Now, if this ever happens and the site is a little bit, it's running a bit slower, you can always reset by going to the main, the top left-hand side, click either of the Hub or PSBC logos, and that'll just take you back to the home page and sort of refresh the screen. All right, but now we can see that the topics are loaded. Yeah, if you scroll down, you can see how many topics will appear based on your search term. First, you'll always see clinical care topics related to the search term that you've used. They'll populate first, and then other resources such as PDFs, tools will follow afterwards. So we've shown you a few different ways that you can navigate to find clinical care topics. So let's have a look at the preterm labor and very preterm birth topic. Give it a sec. Apologies for the delay today. Now, while I kind of let that get loaded up, I'll just give you a little bit of background on some of these clinical care topics. So the topics are written by clinical subject matter experts from across the province, and they undergo a rigorous review process prior to being uploaded to the website. So first, these topics are reviewed internally at PSBC by an interdisciplinary clinical review group, and this consists of nursing, midwifery, and physician representation. Then the topics are reviewed a second time externally by a group of interdisciplinary subject matter experts from across the province. These providers represent rural, remote, and urban settings and work across various settings from acute care, public health, and primary care settings. These topics are then brought back internally to PSBC a final time to be reviewed and finalized before they're ready for upload. Still waiting for it to upload. There we go. Oh my goodness, that seemed like it took a while today. So maybe I'll ask if anyone is following live on their device, maybe if you can just click out of that device, because it seems like that's probably why our site's a little bit busier and running a bit slower. Just follow along on your screen and we'll do the live demo just for the sort of next 30 minutes or so, and then feel free to explore. All right, so as I mentioned, we have subject matter experts who write these topics. So this topic, for example, was written by an MFM physician from Vancouver Island. And as we scroll through the topic, we'll be met first with a short introduction. You'll then find key messages that are summarized and listed numerically. Here, you can access quick and succinct evidence-informed clinical guidance. But if you're looking for more detailed information, you can go ahead and click to expand the key message for more details. Now, within the expanded key message, you'll see that any related clinical care topics or relevant clinical resources have been hyperlinked, and this will be for ease of navigation across the site. Now, on the right-hand side of the page, you can see that there's a red bar, and here, if you click on these icons, you can share or save the topic. So to email a clinical care topic, simply click on the mail icon and then follow prompts. And then if you'd like to save a resource, click the bookmark, and then you can save the resource to a library. We'll cover the library function a little later in today's presentation. All right, so now if you scroll down the page, you'll find that there is a supporting evidence section. Some of our topics, but not all of them, may have additional information here, and it can be found to complement the key messages. Next, you'll find that there's a section dedicated to provider and patient resources. Here, you'll find additional resources that are related to the topic, as well as resources that you can share with your patients or clients. There's also a section to capture the extensive list of resources that were used in creating topics, and a section at the bottom for acknowledgements, which captures the BC subject matter experts who supported the development of a particular topic. If you have specific feedback about the topic you're reading, Feel free to fill out the feedback suggestion box. This will provide anonymous feedback. If you'd like a response to your query, you can email us at hub@phsa.ca, and we'll pop that on a slide later on. All right, so now that we've gotten through our clinical care topic, let's move along, and we're going to have a look at the professional resources landing page. So to get to professional resources, first hover your mouse over clinical guidance on the main banner, and then click on professional resources. Okay. On this landing page, you'll find professional tools, resources, guidelines, and documents that healthcare providers can refer to in their practice. And when you go to the landing page, you'll find that there's three main subsections. So there's practice resources, there's core competencies for the management of labor, and then the home birth supplies program. We'll be making some minor changes to this section in the coming weeks to add a section for practice guidelines. This will allow us to separate our obstetrical and neonatal clinical guidelines from other clinical tools and practice resources. For the purpose of today's presentation, though, I'll highlight the practice resources page. So when you click into the page, you'll find an alphabetical list of all resources, ranging from algorithms and checklists to practice resources, tools, posters, and more. We'll be adding tags and metadata on the website's backend to each of these resources in the coming months, and this will make it more searchable from the main search bar. You can also filter by a specific type of resource from the top banner, or you can just go ahead and scroll through and explore the list of documents to find what you're looking for. We're going to continue to optimize this section of the site to include categories, and this will help further refine that long list of resources. Many of these resources here complement our clinical care topics, and they can also be found linked within any related clinical care topic key messages or in the patient provider resources section of a clinical care topic, which we just showed you. Now, if you click on the three dots on the right-hand side of a resource, you can click to copy the link. You can share the resource via email, or you can save it to your library. You can also click download, and this will open the PDF in a new window. And from there, you can download it to your device if you wish. While you explore this section of the site, you'll find that we've created a suite of new resources and tools for clinicians to access. And as I mentioned earlier in our presentation, the PSBC website will still house patient and family-facing resources, and will still link to these resources from the hub wherever applicable. We migrated all of our pre-existing healthcare provider resources from the old PSBC website to the hub, and anything preceding 2015 has been archived, and it will be removed from both sites unless it's still clinically relevant. The hub is now your most up-to-date place to find provider-facing clinical information. We're currently in the process of cleaning up that PSBC site and removing all those healthcare provider resources from the PSBC website. Now, as I mentioned, at any point as you're navigating the website and you'd like to return to the homepage, you can go ahead and click either of the two logos on the top left-hand side of the screen, and that'll bring you back to the homepage. All right, seems like the site is a bit quicker now, so thanks for anyone who got off. It's working with us, so we'll just keep moving along. So next, I'm going to show you the forms section of the website. So to navigate to this section, hover again over clinical guidance, and then you can scroll down and click on forms. So on the forms landing page, you'll find all PSBC forms used for documentation during pregnancy and postpartum, as well as any accompanying and related resources that support the completion of forms, such as the guide for completions. So here, again, you can click on individual forms and it'll open them up, and you can view them as a PDF and save them to your device if you wish. If your site still uses paper charting, you can click on the Order More Forms button at the top of the page, and this will direct you to the Still Creek Press ordering platform in order to order more forms. Perfect. So we are now going to have a look at the alerts and updates section of the website. So the alerts and updates section of the site can be accessed to find important clinical practice updates and alerts for healthcare providers, educators, and administrators. Alerts are used to indicate a more urgent or pressing matter, such as a supply shortage. Alerts can also sometimes be displayed on the top of the page using a red calamity bar. So when you log onto the site for the first time, you'll see this feature. There's a red banner at the top of the page, and we're currently using the feature to share an alert about our ongoing development with the website and what we're currently working on. Updates, on the other hand, are used to communicate more general practice changes and program updates. So we're going to click into the Good Sam update here, and you can see how an update will look. Now, if you've chosen to register for the hub, there will be a way to opt in to receive notifications about when we post alerts and updates. This is currently still being built out by our website developer, but we expect it to be ready at the end of February. So I'll demo this feature a little later in the presentation when we look at registering and logging in. Okay, so we are now going to move on to the education section of the website. So here on the education page, you'll find information on the various education programs for healthcare providers, including NRP, fetal health surveillance, and ACORN. Please note that PSBC does not offer any provider courses for NRP, fetal health surveillance, and ACORN. Courses are organized by your local health authorities and birthing sites. We do, however, continue to support instructor development for these programs. Here in the education part of the website, you can learn more about the different programs, and you can find related PDF documents and resources to help support your practice. Now, at the bottom of this section, there is an area for additional learning. And here you'll find a list of recommended e-learning courses to support your ongoing professional development. Additionally, we have a section for webinar recordings where you can find any previously recorded webinars that PSBC has hosted. So if we click in to show you, you'll find that we already have uploaded some of the previously hosted webinars, including the recent SUPC and Safer Skin to Skin webinar. Just to note, a recording of today's webinar will also be added here once it's available. So if you have any colleagues that weren't able to join us this afternoon, maybe due to the snowstorm outside, please let them know. We expect we'll have it posted sometime in the next week, and that's where it will be found. Alrighty, so we are going to have a look now at the virtual clinical support page. So this section of the site has been built out to help providers with real-time support for questions regarding clinical decision-making and patient transfers. You can access this page from the bottom of the hub homepage as well, at the bottom of any page. Alternatively, it's at the top of every page. Now, to note, the Maternity and Babies Advice Line, or MABEL, and the Child Health Advice in Real-Time Electronically, or CHARLIE, are both intended to support rural and remote providers only. So they're for communities that may have limited access to resources. The Patient Transfer Network, however, is intended for provincial use and to support patient transfers across sites. You'll find the phone number for the Patient Transfer Network, or PTN, here. Our developers are supporting us to improve the design and delivery of this section of the site so that it's more clear which resources are intended for rural and remote communities, as well as which are intended for the entire province. So you'll see changes coming soon to this section. Alrighty, so we are now going to have a look at our cultural safety and humility page. So this page was thoughtfully created by our provincial lead for Indigenous Health, Jessie Minavariat. Jessie partnered with stakeholders to create a page that pulls together various national and provincial resources and frameworks to help providers take action to end Indigenous-specific racism. Here, healthcare providers will find definitions for cultural safety, cultural humility, and anti-Indigenous racism, as well as different practice frameworks, resources, and educational opportunities. You'll find the 6 key principles of cultural safety and cultural humility, as well as the 4 R's of cross-cultural dialogue. Towards the bottom of the page, there's also links for various Indigenous perinatal programs, partners, and resources that are available within BC. So the next part of our demo will look at the screening program page. So the screening program is a frequently accessed part of the PSBC website for many clinicians. When we created the new Hub website, we wanted to make sure that the format aligned with the PSBC website to ensure that the transition to the new site went smoothly. As you navigate this section of the website, you'll find that the format is similar to the PSBC website, but the design looks a little different to align with our overall Hub design. All healthcare provider content has been migrated over to the Hub and can now be found here. If you're looking for pamphlets or resources for your patients related to screening, they can still be found on the PSBC website as they are patient-facing. However, if you're using the Hub as your one-stop shop platform, you will find a link to these resources on the Hub so that the transition between those two sites is seamless. When you click into the main page, you can choose between prenatal genetic or newborn, depending which screening program you're looking for. And then when you click the button, you'll see that an accordion list of headings pops open with different popular topics. Depending what you're looking for, you can click to open the page and navigate to this section of the website to learn more. Now, related to screening programs are the calculators, and they are very popular on the PSBC website. So calculators can be accessed from different areas of the website. The quickest way, though, to access calculators is by hovering over clinical guidance and clicking the drop-down arrow, and either clicking on the word calculators or that drop-down arrow. From here, you'll find our popular EDD calculator, as well as the trisomy 21 risk calculator. So I'll open the EDD calculator page. This will take a second to load. And then once it loads, you can click on the relevant banner bar to open the calculator that you're looking to use. Wonderful. All right, so for the last part of our demo today, we're going to have a look at registering and logging into the Hub, as well as the create a library function. So you might wonder, why should I register if I can access all of these resources without registering or logging in? The reason for this is because if you register and you create an account, you have the ability to create libraries, and from there you can save your favorite resources for quick and easy access. You can also share libraries that you've created with your colleagues or with students. Additionally, registering allows you to subscribe to notifications of important alerts and updates. So we'll go ahead and click register there. Perfect. Now we'll no longer be posting healthcare provider related updates on the PSBC What's New. So the PSBC site will strictly be used for patient and family resources, as well as for communication to the general public. Now that we're on the register page, all you have to do is type in your name, your email address, and then create a password. When you're registering, you have to check both boxes at the bottom to allow you to register. Now, the second box, which says I agree to keep my profile searchable for other Hub users, is not functional, so don't be alarmed by this. No one will be able to search you, and the box is actually going to be removed quite soon. If you've already created an account and you're looking to sign in, you can go ahead and click on the sign in logo at the top right-hand side of the screen. From here, you can type in your password and your email. But if you've forgotten your password, don't worry. You can go ahead and change your password by clicking on the Forgot Password button. You'll be sent a temporary password by email. Just remember to check your junk email folder. And remember that the temporary password given to you is case sensitive. You'll use the email to reset your password. All right, so now that we've covered registering, let's go ahead and log in. So when you first log into the Hub, you'll be taken to the My Hub homepage. Here, you'll find both your favorite resources as well as any libraries that you've pinned. And as you navigate across the top bar, you can choose to either open the My Favorites or the My Libraries page, and you can access your saved resources here. Now, if you've previously created a library, you'll see it here. And you can click on the little pin on the right-hand side of the library. This will pin your library. To share your library via email, you can click the 3 dots on the bottom, and this will allow you to email it. From here, just follow the prompts. You can also delete an email, delete a library from here if you no longer want it. All right, so let's go ahead and open our library. Okay, so from within the library, you'll see that you can also email and delete a library from within. And the pencil icon allows you to rename your library and change the description. So now that we've covered that, let's go back to the My Libraries page. We're going to look at how we can create a library. So there are a few ways to create a library. The first is actually by clicking the Create New Library button on this page. Once you click this button, go ahead and choose a name for your library and create a short description if you'd like. Once you've created the library, you can search the website and you can save clinical care topics, forms, practice resources, calculators, and more. You can see I've created a library here related to labor resources, so I'll go ahead and add some of the items to my library. Now, another way that you can create a library is once you click a resource here, you'll see that there is a plus icon to create a new library. So we'll add some resources to our newly created library. And once you have all the resources that you want in your library, you can click the My Hub at the top of the page, and then select My Libraries, and you can view your newly created library here. Perfect. So now I've got all my resources in one spot. Now, as I previously mentioned, you can also opt in to receive email notifications for alerts and updates posted by PSBC. Our website developer is currently building out the functionality of this, and it should be functional by the end of February and live on the website the first week of March. But until then, make sure you do keep an eye on the alerts and updates section of the page, of the website rather, to stay informed of any alerts and updates that we post. Now, to opt in to receive notifications in the future, hover over the My Hub and then click on Account Profile. On the top banner bar here, you'll see that there's a section for notification settings. So from here, you can check the related boxes to opt in, and then make sure you click Update Notification Settings. This will ensure that your new settings are saved. Now, even though this is not yet a functional workflow, if you go ahead and opt in now to receive notifications, once the workflow is built out and functional, you won't have to redo it, and you'll actually just you'll begin to receive alerts and updates at that time. Okay, great. So now we're all set. So that's a quick demo of our site. Now, obviously, the site has a lot there, and I offer you all the opportunity to explore. That'll wrap up, though, the demo piece for today. So as I mentioned, the website is still in development, and we are going to continue to improve the site in the coming months. If you have any feedback about the website, or if you have any questions as you familiarize yourself with it, please feel free to email us at hub@phsa.ca. We're also excited to offer personalized site demos for our stakeholders. So if your team is looking for a one-to-one site demo, please connect with us via email, and we're happy to support that. And on behalf of the whole Hub team here at PSBC and Provincial Digital Solutions, previously known as the Office of Virtual Health, we'd like to thank you for your continued support and for joining us today. We have one final poll to answer on, for you to answer on how likely you are to use the Hub in your practice. And then I will hand it over to my colleague, Kristen Corns, who's our Senior Leader for Provincial Education at PSBC, and she will open it up for a Q&A. So if you have any questions that have come up, feel free to fill them into the Q&A box after answering the poll.
Thank you, Melanie and Sahana, for that comprehensive, excellent tour of our Hub features. I think you covered most of it because there's not too many questions so far in the chat, in the Q&A, but we'll just let everybody answer their poll and then give them some time to type out some questions. Looks like we're still getting some people responding to the poll. And it's starting to slow down a little bit. So it looks like some of our colleagues are going to find this site fairly useful. So that's excellent. Thank you for participating in that poll. I'm going to go to the question of Q&A. One question that Kyla Congress has already answered for us is someone is trying to create an account and I agree to keep my profile searchable by other hub users box is required to click to complete the profile, and that is accurate. The button is not operational though, and it will be removed. So you will need to check that box, but nobody will be able to search you on the hub. Second question, Lisa Farrow has asked that she missed the tab when she went into select profiles and notifications, felt that this was extremely well done. So if you are, once you're registered and you go into My Hub, you will see there's a tab at the top left, I believe, that says My Hub and notifications. And so you can find that there. Allison Eller said, this isn't a question, just a comment, that this work is incredible. Thank you for this orientation opportunity. Thank you, Allison. Shannon Chang has asked, thank you for this informative session. Is it possible to export one's library instead of send it via email? I will send that one to Kyla if you have the answer to that question at this point.
So you can download the documents for those that are downloadable. You can find the tab on the side.
Thank you, Kyla. The next question is from Allison again. Is the longer term plan for client-facing resources to stay on the PSBC site and that the hub is directed to care provider population? I can answer that. We will be keeping most of the client-facing resources and information on the PSBC site, but we are also working on a learning, remind me what the title of it is, Learning Center, I believe, that has prenatal care, and a lot of the information will be hosted on that site, and that will be coming sometime this year. We are currently just working on that, but you will be able to find all of those resources on the PSBC website. And as Melanie mentioned, there are still some client-facing resources in the provider resources section of the clinical care topic that you may be searching in. How can a research unit begin the process of contributing clinical evidence to the hub? That is an interesting question. So I think that we could probably answer that one offline. If you want to send us an email at hub@psbc.ca, that would probably, we could be able to explore that question a little more fully. Lisa Farrow, can we redo the poll? I signed very unlikely and less very likely. I don't think we'll redo the poll for this one, but we'll note that the very unlikely was supposed to be very likely. Tina Lazarek has asked the question, do you have the opportunity to see what users are searching for the most and add additional resources based on user requests? Yes, and I will hand that over to Kyla because we are taking metrics and tracking what areas of the hub are being looked at most, but Kyla can answer that a little more fully.
Yeah, so under clinical care topic, we are collecting Google Analytics, which shows us what are the most viewed resources. We also have the opportunity to, in clinical care topics, sort them by the most viewed. I do need a little bit more information on adding additional resources based on user requests. If you have a bit more detail on that, that would be greatly appreciated. We at the bottom of the any landing page, you see a feedback form. If you have a recommendation, if you can add that there.
Thanks, Kyla. Moving on to the next question. When will the public site, the PSBC website, have the healthcare section removed? I will hand that to Melanie to address.
Thanks, Kristen. That's a great question. So we are already removing some of that healthcare provider content from certain areas. So that health professional section of the PSBC site will be sunset. We're doing it gradually because we know people still go there and we want this to sort of happen in a transitional period. So the initial piece will actually be having the redirect. So for example, if I was looking for forms and I go to the forms landing page on the PSBC website, you'll see now that there's a redirect. And if you click that, it will bring you to the hub. And we're actually going to make sure it brings you to the specific page on the hub so that you know where you're going. So yeah, it's going to be a phased approach. We are hoping to sort of have everything kind of complete by March. And then we will from there, kind of completely remove that health professional section. Great question.
Okay, next question. How will you be advertising this amazing resource with physicians, especially pediatricians? We do have a communications plan, but if you have a group and you want us to do some sort of live demo, you can contact us at hub@phsa.ca. We also have, I believe it's being advertised on X, formerly known as Twitter, LinkedIn as well. It should be on there. And I'll ask the panel if there's any other ways we are, I think Doctors of BC, Marianne, is that correct?
That's what I was just going to jump in and say. Yeah, there's a variety of information resources we can send out that way.
But please email us at hub@phsa.ca and we can provide any information that you want to share with your colleagues. Janet Krenz has another question or a comment. Wow, this looks fantastic and very user-friendly. I will definitely use and promote this site. Thank you. Thank you, Janet. That's awesome. Kelsey Ricks. I'm very excited to go through the cultural and humility section and happy to see it's actually the first tab. Thanks, Kelsey. Jesse Minabariat put a lot of effort into that to ensure that it was very comprehensive and included all the resources that would support education and any sort of action that you can take towards ending Indigenous specific racism. So thank you for that comment. We'll be sure to pass it on to Jesse as well. Next comment is, this work is fantastic. And the question is, how often is the hub content reviewed? So we have been looking at that, and from professional practice, it's every 3 years. However, as new research or new updates come available, we will contact subject matter experts and ensure that we review it as new information or any sort of evidence comes available. So there's 3 ways, I guess, the site will be, or the content will be reviewed. 1, if there's new updates. 2, if there's anything that we hear from feedback. And 3, in a 3-year cycle as per professional practice. Sandra Grant, thank you for your collaborative leadership and making evidence-based, up-to-date information accessible to frontline providers. The chat is closed, so sharing this comment here. Thank you, Sandra. Sarah Morton, I missed the tab for where these virtual sessions are posted on the hub. I would like to ensure distribution, and Kyla is answering that as we speak.
Sorry, just under education, there's an additional learning category, and you can find it under there.
So if you scroll down from education at the very bottom, it says additional learning. You can click on that and it'll say webinars, and you will see that this will come up as soon as we get the recording. Do you have a registry list of healthcare providers available to provide review of upcoming sections, topics, etc.? We do keep a list of that on our Excel. Everybody who has participated in reviewing or providing content. If you're interested, because this person is anonymous, you can please also send us an email at hub@phsa.ca because we will be starting with the new topics coming up, some more external review processes, and looking for writers. Katrina Eng, thanks Kyla Pongrats for answering the question about my library. Great minds think alike, Stacey Remball. So you got your question answered, excellent. Are there any qualifications required to register? Kyla is typing that in. I'm reading faster than she can type.
So just none at this time.
Okay. Marie Howell, there are guidelines 20 postpartum nursing care pathway and guideline 13 newborn nursing care pathway. Will these be updated and will they be housed on the hub? I believe these are the ones that we are currently updating, that are being updated in progress right now, particularly both postpartum and newborn nursing care pathway. We're just updating our MSS, our maternity services strategy. And so we're hoping to get those done and updated and on the hub middle of the year at some point in 2024 though. The content is so well done. This is also from Marie Howell. As a person who's been working on updating resources and our competency tool here in IH for perinatal nurses. Fantastic job. Thank you, Marie. And Allison, how does the perinatal hub, does the perinatal hub related to the pregnancy hub? Just clicking on the pregnancy hub. Is this BCA POP? Yes. So I think for us, this is more for provider facing resources that the hub is used for. And we have, very comprehensive clinical care topics and more useful provider information. BCA POP supports this as well. And it has a lot of information for, I think it's for clients and pregnant persons. I think they have both, but we are working kind of in tandem with them and they're aware of our site and we're aware of theirs. So we're kind of complementing anything that they have. But they aren't actually related. They're not supported by PSBC, the pregnancy hub. Anything to add to that? Melanie or Marianne? Okay. So that's the end of our questions at this point. Leave a couple minutes just in case there are more questions. Thank you everybody for these great questions. We hope to have the webinar up on our site shortly. We should be getting the recording within 24 hours, I think it is, on Zoom. And then we can upload it. And you can go through all the pieces that you missed. And please don't hesitate to contact us for any feedback. We are consistently and constantly gathering and looking at the feedback that we get. And if you aren't sure where to go, or if you want us to give some more information, please just contact us at hub@phsa.ca. Happy to answer any of your questions there.
All right, thanks very much, everybody. Have a wonderful day. Thanks for joining us.
I don't see any more questions. Thank you very much.